Hi, Tanya from Created Health, Nutrition and Fitness. If you have not subscribed to my YouTube channel, please do so. It is totally free for you to do so, and when you do subscribe, you are the first to be notified when I update my YouTube and put on a new video like I'm doing right now. So today I'm looking at some research around, and the paper that I'm looking at is the role of omega-3 polyunsaturated fatty acids in the prevention of preterm pregnancy. So what is preterm birth? It is defined as delivery before 37 weeks, completed weeks gestation. Now, unfortunately, in regards to preterm births, there are 15 million babies born worldwide preterm, and out of those 15 million, 26,000 of those are born in Australia, and this does have a cost to the Australian economy of $1.4 billion annually in the care for both the mother and the baby when it comes to preterm births. So of that, 30% of births that are preterm, 30% of them happen at 34 weeks gestation. So as you can see, this is quite significant and needs to be addressed. A lot of this is through making sure that you get the nutritional support to support a healthy pregnancy, a healthy baby for development throughout the pregnancy as well. This is why I recommend that people come and see me for preconception care, and obviously once you have conceived, to come and do a consultation with me throughout your pregnancy to make sure that you are getting all the required nutrients so that we can have a healthy mama and a healthy baby. So getting back to preterm birth, this is quite concerning because we do know it is the leading cause of death in children up to the age of 5. Preterm birth increases your risk both short-term and long-term with health complications as a baby, as well as across the lifespan. And the concerns that we mainly see in regards to preterm birth are things such as visual impairment, development delay, learning difficulties, and mental health issues. And these predominantly present such as anxiety and depression, both in children and adults. And we also see it in regards to mothers when they present to clinic in the form of postnatal depression. So maternal depression is an important discussion that we do need to talk about and be opened about. So unfortunately, in regards to preterm births, we have seen that the rates have not varied at all between 2011 and 2021. So the fact that they have been unchanged is quite significant as well. So remember the name of this paper that we're looking at today, the role of omega-3 polyunsaturated fatty acids in prevention of preterm birth. Please read it, and I'm just going to give you an overview of what it is, but you know, if you are considering conception, please read it because it does give you a big insight into preventing preterm birth and the complications that are involved with it. There is a large body of evidence revealing the effectiveness of omega-3 fatty acids in supporting a healthy pregnancy. There's many meta-analyses that have established adequate levels of EPA and DHA are associated with the improvement of fetal growth throughout the pregnancy and reducing the risk of preterm birth. There's over 70 randomized controlled trials that found omega-3 fatty acid supplementation during pregnancy reduced the rate of preterm births. Pregnant women with low DHA and or DHA blood levels increases their risk of early development, and this is as easy as a finger test, a blood prick finger test that you can do to get to know what your status is in regards to your omega-3 fatty acid index. So in 2018, a Cochrane meta-analysis plus other randomized controlled trials concluded that omega-3 interventions resulted in a 12% reduction in preterm birth risks and a 35% reduction in early preterm birth rates. So as you can see, it is quite significant. DHA supplementation changes the balance between the ratio of omega-3 fatty acids and omega-6 fatty acids, and these have a great influence on the uterine contraction during pregnancy and the cervical ripening for delivery of baby. Omega-3 regulate the myometrial contraction, delaying early labor. So it is significant when it comes to not only the development of the baby in the womb, but also when it comes to the end of your pregnancy and going into labor. The Australian guidelines recommend that we have an intake of between 250 to 500 milligrams twice daily of DHA and EPA, and this can be met simply by having 2 to 3 serves of seafood per week in the form of oily fish, or if you are opposed to having oily fish, or you'd prefer a more easy way of consuming and making sure you're getting your adequate levels, then you can do this through supplementation as well. During pregnancy, it is recommended that at least 500 milligrams of DHA starting at 12 weeks of pregnancy and no later than 20 weeks of pregnancy. And then it is also recommended that you cease your omega-3 supplementation at 37 weeks, and it is important to make sure that your levels are correct throughout the pregnancy, and that you do, if you are supplementing, that you decrease that or actually cease it at 37 weeks. Women with low omega-3 status, and remember I said you can get that through a blood test. If you have a low omega-3 status, then you need to be having 800 milligrams of DHA and 100 milligrams of EPA daily, and that is what is recommended to reduce your risk of preterm birth. So if you are considering having a baby, considering conception, reach out and book a consultation with me. I would love to support your nutritional needs for a healthy mum and a healthy bub and a healthy pregnancy and labor, because at the end of the day, your health is your wealth. I'm Tanya from Created Health, Nutrition and Fitness, helping you create a healthy baby, a healthy body, and healthy babies.